Good afternoon, viewers. We are live again today, and we have today with us Dr. Manoj Kumar, who is a consultant in the general medicine and general and GI surgery department. Welcome, sir, for this session.
Hello.
He's here to discuss about the health risk associated to obesity, and he's going to take questions related to that topic. So before we take the questions to sir, the platform is open for you to address our viewers.
Thank you, Kaushik. Obesity is defined by the WHO as the abnormal or excessive accumulation of fat in the body, which results in risk to health. Nowadays, it's of more consequence as obesity has reached an epidemic proportion. About 39% of people world over are either overweight or obese. In India, about 135 million people are obese. So now this puts the things to perspective. Fundamental to the understanding of the obesity is the concept called BMI, or the body mass index. It is essentially the ratio of weight to the height of an individual. As the weight increases, the body mass index increases because the height of a person does not change after a certain age. There's also another concept called as truncal obesity, which is very common in Indians. Although the BMI or the body mass index might be within normal limits, they tend to have more fat accumulation around the midsection or the tummy area. This also is it increases the risk of the diseases which result from obesity. Obesity in 2013, American Medical Association surprisingly has classified obesity as a disease. So when the body mass index exceeds 30, it is defined as obesity, and this is considered as a disease.
Okay. So sir, I'll just take you to the questions which have been asked to us. The first question which has come to us is, how is overweight differentiated from obesity?
Yes. So based on the body mass index, person can be classified as normal, that is normal weight for a particular height, then overweight, then obese, and morbidly obese. So in that, so when the body mass index, that is the weight for height ratio, is well within, about less than 20, then it is subnormal. Then 20 to 25 is normal. Then 25 to 30 is overweight.
25 and above.
25 to 30.
To 30, okay.
Yes.
Okay.
When the body mass index is 25 to 30, then it is called as overweight. Above 30, 30 to 35 would be obese. And more than 35 would be morbidly obese.
Okay.
Yes. So it's basically a spectrum as the weight increases against the height.
Right. So the next question is, what health risk can obesity cause?
Yeah. Obesity brings with it a myriad of various diseases. Like for example, it throws the blood sugars haywire, causing diabetes mellitus, then shoots up the blood pressure, resulting in hypertension. Then the accumulation of fat around the neck and the back of the mouth results in snoring and breathing difficulty, especially when one is asleep, and results in carbon dioxide accumulation. As well as once the body mass, the weight is substantially increased, the joints cannot take the weight, and so they'll develop joint pains and joint deformities. So all these over a period of time sum up and they snowball into different problems such as heart attack or the clotting of bloods resulting in pulmonary embolism and strokes and various other.
So it's like a series of chain reaction which can happen.
Yes.
Right. So the next question here is, what are the health risks of morbid obesity? So we are talking about above 35 of BMI.
See, whatever changes we just discussed or obesity are actually multiplied manyfold when it comes to morbid obesity. Like say for example, the accumulation of fat. When it becomes prohibitively high, the snoring goes on, and it causes some sort of obstruction wherein to the breathing apparatus. So that's called obstructed sleep apnea, and this actually results in itself, it's a very major risk factor for death.
Oh, okay.
Yeah, and so another issue with morbid obesity is whereas in the obese population there is still a way out of it through the way of by the way of diet and exercise, whereas morbidly obese people, because of all the various diseases that they have accumulated, they may not be we won't be able to reduce their weight or bring it back to normal only based on the diet or exercise. So these are the people who require bariatric surgery.
Okay. Okay. What are the biggest causes of obesity?
Obesity, as such, the causes are multifactorial, meaning there are multiple factors which conspire or which combine forces to result in obesity. So like for example, there is genetic, then dietary, and as well as lifestyle, lack of exercise. All these factors combine, and then slowly over a period of time, all of us actually, or from the time for childhood, as we grow, slowly we accumulate mass. We grow, we become heavier and heavier. So because body is an excellent conservator of energy, if it does not need to use even one single calorie, it converts it into fat. So that is the sort of efficiency we're dealing with. So now if we have to maintain that balance, so that means the energy that we take in must be equal to the energy we spend. Yeah. Right. So now over a period of time, what we have seen in the lifestyle, like say for example 25 years ago, the processed food that we consume today was not known. Well, nobody knew about, like burgers or pizzas or whatsoever, fries, all these. So they are not known, or very few people had access to it. The increase in the socioeconomic status of a person, as well as easy accessibility of food, and as well as like even for that matter, nowadays we used to earlier go to use a public transport, we have to walk to the bus station or go to get an auto or a taxi. Now we can hail it with just an app, so it comes to you. So the amount of work we do, the sedentary nature of our life has increased, and as well as the food, which is not helped at all. So these are the most important causes.
Triggering factors.
Yes.
So since we discussed the triggering factors, the next important thing is what are the treatment plans available now to manage obesity?
So as far as the overweight and the obese are concerned, so these people are the ones who overall actually obesity has to be treated in a holistic approach, which includes a regulated or a careful planning of diet, as well as a graded mobility exercises, and depending on, especially the morbidly obese, there is an option of bariatric surgery.
Okay, so people who have a BMI of over 35?
Yes.
Right.
Or even the people with BMI of 30,
okay,
right, 30 to 35, that group,
okay,
with lot of risk factors, that is people who have a heart disease, or who have uncontrolled diabetes, or any other like osteoarthritis, that destroyed knee joints or something. So these are the ones, because you can't put them on a strict dietary regimen or exercise. Yeah. So those are the ones who become the candidates for bariatric surgery.
Perfect. Can obesity shorten life expectancy?
Yes. As we have already discussed, obesity with all the accompanying diseases, naturally it's a no-brainer that yes, it decreases the life expectancy. In fact, actually an American study has shown that extreme obesity shaves off about 14 years of life.
14 years?
14 years of life from a person.
So we are talking about people who are obese and morbidly obese, both.
Yes. So as we gain weight, the life expectancy reduces.
Well, okay. Can morbidly obese people be healthy? Well,
Yes, in
the
most.
question is, see, you will look at somebody and say, boss, you are morbidly obese and you need to take care of yourself. The person will counter saying, no, but I'm absolutely healthy, I feel okay.
Yeah, so actually in India, being obese is euphemized as healthy.
Healthy, yeah.
Yeah, that person is healthy.
He
Yeah,
is
he's
good,
healthy.
huh?
Yeah, he's healthy. So
Right.
actually, I think that's far from the truth. It's not because based on evidence, the scientific evidence that we have, obesity is scarcely you can classify it as healthy. No. So, but yeah, maybe overweight. Overweight people, they have, they still can be active. There are quite a few overweight people because there is one problem with BMI. Say, for example, a person who is very muscular or who's got a good bone weight, their mass also will be high for their height, but their BMI will be high. However, they are overweight, but they will not. They are still healthy. So those are the ones. But morbidly obese, it doesn't classify. Maybe it's perhaps just an oxymoron to call a morbidly obese healthy person. No.
Right. All right. What are the warning signs of obesity? For a candidate, say an individual has a sedentary lifestyle, and what are the first
You said that,
trigger
yes.
points? Yes.
So yeah, nowadays most of the people who we work indoors. Then most of the time it's a desk job, right? And very little mobility, as well as the diet. All those because of all these problems, we need to know what exactly when are the what are the signs that that have to alert us.
Yes.
Right. So the simplest test is like your inability to walk briskly. Right.
Okay.
You walk briskly, and as well as you get breathless just walking 2 flights of stairs. So these are very simple tests, very crude tests, but still they are of some use because at least they should alert a person, yes, I have to do something about my weight. And there's another simple test which even they in the pre-anesthesia checkup of a patient is done. It's called the 6-minute walk test. It can be done at home. So wherein you just time 6 minutes, you just walk in a straight line and see how far can you walk. If it is less than 400 meters, that means you are at a high risk.
6 minutes, 400 meters.
Yes, less than 400 meters. Okay. Right, it's high risk. It's not like more than 400 you are absolved. You can still no, but still it's a cause for concern. But when it becomes since you're asking warning signs. Okay, these are the and also there's another study which says that if a person takes more than 24 minutes per mile,
okay,
yeah, the cardiovascular risk increases is by more than 40%, actually 43 or 46%. So it's phenomenally high. So one mile is about 1.6 kilometers.
6 kilometers, yes.
Yeah. So taking 24 minutes for that, for just 1 kilometer, it is essentially a function of your bad cardiovascular as well as your general health.
Right.
So these could be, crude markers of, or rather a warning sign, which should help any person to alert themselves.
Right. Next question is, what are the treatment plans available for people who have morbid obesity? So we have spoken about the larger obesity, but then there are people who cannot be given a lifestyle change, or probably medication won't give them the desired results. So what are the treatment plan for those people?
These are the ones who qualify for what is called as bariatric surgery. Bariatric surgery, basically it's derived from a Latin term called baros. Baros means pressure, heavy. Okay. So it's basically bariatric surgery is something which it's a surgery which is done to reduce the eventually the weight of the person, reduce the weight of the person. So that is bariatric surgery. Essentially, briefly, if I can mention it, it's
sure,
how we absorb whatever we eat is because of the highly efficient stomach as well as the intestines. The stomach is an enormous reservoir. It can take enough beating. You can go on eating and
processing the inputs.
No, it can store. It's as a storage device. As soon as we eat, it just stores a lot of food, and then it pumps. It digests it halfway and pumps it into the small intestine. So, and then where the absorption of nutrients happen. So now the premise on which bariatric surgery is based on is reduce the size of the stomach so that we reduce our intake.
Okay.
Right. So the
So you are reducing the size of the vessel itself.
Yeah. So yeah, the container. Yeah. So the the amount of calories that we consume will be cut down. So and also there's another concept called there's a hormone which is secreted by the stomach. So that hormone also is reduced, is cut down significantly. That hormone actually increases our appetite.
Okay.
It's called ghrelin. It increases our appetite. So our appetite is cut down, and as well as the capacity to ingest more food is cut down. So eventually the body goes into a negative balance. Okay. Right. So they start losing weight. So this is one. The other one is in very morbidly obese, like more than 50 or 60 BMI. Those are very heavy. Those are the other candidates who definitely require surgery. So these people, there is another malabsorptive procedure which we do, where the intestines are directly the part of the somewhere lower down. Intestine is about small intestine is about 2 meters or more in length. So about 100 or 150 centimeters of the small intestine is bypassed. So that length is not available for absorption.
Right.
So again the body goes into a
imbalance.
Yeah, there is a negative. There's a deficit of energy. So when they eat, there will be first of all they eat less. First of all, they appetite will be less, yes. And then even if they eat less, yes. And then the third, the absorption is also less. These are the three ways in which bariatric surgery acts.
Perfect. Next question is, can obese people develop cancer? What are the chances they can develop cancer?
It is well known, epidemiologically it's been proven that cancers such as colon cancer, breast cancer, endometrial cancer, these are quite common in the obese, especially in the Western population. It's been seen, very well studied. And also liver cancers, esophageal cancers actually because of reflux or whatsoever. Then thyroid cancers, these are all known among the obese people.
Right. So we are coming toward the end of the session, and before we say goodbye to all of you, we have one last question for you, sir. The question is, can you please share some preventive tips to avoid obesity, and how do they actually lead a healthy life?
Yeah. So
because most of the people are confined at home and pretty much having a sedentary lifestyle.
So yes, so it's energy balance. Right. So it's simple physics, energy balance. If you take a balance, you have the calories consumed and the expenditure. So either you reduce your consumption or increase the expenditure. So it's just basically it's very simplistic, to think that okay, it's just maintenance of energy balance, but it is extremely hard to practice. Right, because the easy availability of food, then absolutely sedentary lifestyle, so it's extremely difficult. Perhaps obesity is the penalty we are paying for all the conveniences we are enjoying actually.
Wow.
So actually in a study of medical professionals in US, in the middle age, especially there is in the middle age people, there is slow loss of muscle mass and increased fat. This is a physiological process. So when you eat, normally say for example a young person in the 18 to 20, 25 years, when they eat, they have the energy can be used for gaining the muscle mass. Whereas as we age, in the middle ages and above, most of that food will be converted to fat. Yeah. So it was seen in the medical professionals that consumption of potatoes, chips, aerated drinks, and processed red meats, these were directly proportional to the weight gain, and consumption of vegetables, fruits, nuts, and milk products like yogurt or something, they were associated with they were negatively associated with weight gain.
Right.
Yes. Yes. Other thing, this is about the intake and expenditure. That is the so moderate exercises, such as brisk walking, is definitely helpful. Again, in another study, 150 to 250 minutes of moderate activity per week is is not associated with the weight gain.
Okay.
It's not associated with the weight gain.
So it is advised that
Yeah.
they should work, I mean, physically be active for at least those many hours
Yes,
in a week.
150 to 250 minutes. This is also studied well. And if it is more than 250 minutes, you will start losing weight.
Okay.
So this is like,
Like
both
you said,
in-
like you're balancing.
yeah. So
How do you manage
Yeah.
both the parts?
So that should, I think, yeah, it's a difficult thing to do it, but then this is a means of doing it at least.
Thank you so much, sir. Well, with this, we have come toward the end of today's session. Thank you all for joining us. And if you have still other questions, you can drop those questions in the comment section and our experts will come back with the answers. Thank you so much.